Good afternoon and welcome. I'm Philip Hiltz, the director of the Knight Science Journalism program at MIT. And for today, I'll be the moderator of the forum at the Harvard School of Public Health. The forum is a set of regular live discussions with leaders in public health. And today we have with us Helen Clark, who is the former Prime Minister of New Zealand and the administrator of the United Nations Development Program. While nations themselves have development agencies, the UNDP is the world's development agency. It's run cooperatively by the countries through the UN in 177 countries. The UNDP works on a broad range of issues, including issues such as eradicating extreme hunger, empowering women, building infrastructure, and a signature program over the years has been the Millennium Development Goals, under which countries work toward 8 specific targets. They started in 2000, and they're supposed to end in 2015. So the question right now is, how are we doing?
Well, not so badly.
Yes.
At the global level on quite a lot of the goals. For example, the goal that was set for reducing extreme poverty was to cut the numbers of people living on under the $1.25 a day income poverty level by half over those years, 1990 to 2015. And that's been achieved already. But it's been achieved largely, overwhelmingly, because of the incredible poverty reduction in China over that period. Hundreds and hundreds of millions of people. And the truth is the figure hasn't moved much in some other regions, sub-Saharan African countries, many still struggling to get that sort of impact on poverty. So there's still work to do, and even though these targets end in 2015, we can't stop. And the big debate now is what's going to happen after 2015 and how we carry on to deal with the unfinished business.
What about some of the other 8? Besides the poverty, how else are we doing?
So the second one was around getting every child into school. And almost every child in the world is enrolled in school now. Around 67 million aren't, which is a significant number. As a proportion tiny, but every child should be in school. However, how long a child enrolled in school actually stays is another matter. The completion rates will not look very impressive. So again, in unfinished business, it's got to go beyond getting a child's name on the school register to the child actually staying in school, completing primary, and being in a position to go on the next stage. So unfinished business there. Empowerment of women. Well, there was a target set of 30% women's participation in the world's national legislatures. We're not there. We're probably around 19% at the moment.
But that's an improvement.
It's definitely an improvement from where it was. And some of the most conflict-affected countries have actually done the best, because as part of their rebuilding and national reconstruction after disaster, take Rwanda, they've prioritised the involvement of women. So Rwanda now has the highest proportion of women legislators in the world from having had women not at all represented in such bodies. The child and infant mortality rates have reduced very significantly. We could say those goals are within reach, but they need a push. One which has been very disappointing is maternal health mortality and universal access to reproductive health. And this sort of will lead me into the theme I'm going to talk about in the lecture later today. That these issues are not just a matter of a health sector intervention. The fact that women's health has done so badly speaks to a lot of greater factors about women's marginalisation, gender inequality, disempowerment, and so on. We need to tackle a rather basic range of issues to bring down what are very distressing maternal mortality rates in many countries. And sometimes I think when we think of maternal health, we're perhaps thinking of a woman in her mid-late 20s, 30s who's dying in childbirth, and of course many do. But so often the picture is of really quite a young girl, an adolescent girl who's dying a very miserable death in childbirth because she is too young. Things haven't gone right. Maybe a whole lot of things in her life that have just not been conducive to having a safe childbirth. HIV/AIDS, malaria, TB, quite a lot of progress in turning the tide, and some of the countries which saw extremely high prevalence in sub-Saharan Africa definitely have turned the tide and are investing a lot more of their own money in to fighting the disease. But the Global Fund money has undoubtedly been incredibly important for that. And then you come to the environmental indicators, improved drinking water sources. Yes, we'll probably meet that, but that's not to say everybody's got clean or drinkable water. The sanitation goal has done very badly. Perhaps toilets aren't, the most exciting thing to talk about, but very important for health. And that's not so good. I was on a platform with the Minister of Rural Affairs in India last year, and he has a line where he says, "What's wrong with my country? Almost everybody has a cell phone, but most people don't have a toilet. We have our priorities wrong."
Yes, yeah.
So, we have our priorities wrong. We need to move on that.
So you've probably spent a lot of time in the field. Tell us a story from the field that is one of success. Where has something happened that was really good to see?
Well, sometimes when we look at how countries are doing on these indicators, we think, oh, they're a long way from reaching that. So I went almost 3 years ago to Burkina Faso, which has had quite a troubled past in its birth as a country from the colonial era. It was Upper Volta, it had a lot of instability. It's had a stable government with a very long-serving president for a long time, and they've started clawing away at these basic indicators. So you go and you see that 68% of children are now in school. Now you could say, glass half empty, but what about the other 32%? Or you could look at the rate of adult literacy, which is under a quarter, and say what an incredible lift up that is. Now there's still work to do, but undoubtedly there's progress. And on addressing extreme poverty, Burkina Faso has really taken up something we got involved with, which was how to get basic motor engine power into a village. Villages generally have no electricity at all. So no electricity, no light, no capacity for children to study at night, no capacity for women to lighten their burden of domestic chores. Taking the husk off a rice is hours of painful grinding in a bowl. You bring an engine into a village, all of this changes. We showed proof of concept of this, and the government has agreed they will take that right across the country. Every village will have these motor-powered engines.
Generator.
A small generator, and you would be amazing the difference to life that makes.
Yeah, that's amazing. So we started out in 2000. I remember thinking at the time as a reporter, the goals were ambitious. So what do we know now that we didn't know then? Because we're coming right up on 2015.
Well, coming to it a bit fresh as I do, I went to the Millennium Summit in 2000, where the Millennium Declaration was signed by all of us there as heads of government, as I was. And then Kofi Annan announced the MDGs and said, this is the path to achieving the vision of the Millennium Declaration. But I think there probably was not enough attention for the first decade on what is it you actually need to do to change these figures. And when I came to UNDP, I said, look, we really need to focus on the drivers of progress. And we produced a very good report for the 2010 Millennium Development Goals Summit on what will it take. And we identified a range of factors. Now, one of them was leadership. If you don't have national leadership and ownership of these agendas, you'll never make any progress. This is not something a development agency or development partners can do. It has to really burn in the gut and the heart of leaders in countries at every level, government, civil society, whatever, that this has to be done. This is a national cause. And where that's happened, you've seen real progress. Most certainly you need inclusive growth, not just any old economic growth, because a lot of it doesn't do anything for poor people at all, completely marginalised by it, and a lot of the extractive industry growth is very much in that category, unfortunately. So inclusive growth, definitely investment in health and education. Energy as a huge enabler is critically important. Wasn't mentioned in the MDGs, but I'm certain it'll have a place in the next agenda specifically. And the other factor we identified was social protection. Because unless you have a basic social protection scheme in a country, people can, sort of come up the living standards ladder, and then something disastrous will come along, which might be the global recession, or it might be a terrible flood, or it might be a drought, or it might be an earthquake, whatever, and you are knocked completely back with nothing.
So what exactly is social protection?
So social protection is what Franklin Delano Roosevelt did here with the New Deal in the 1930s. It's what Labour government in New Zealand did in 1938 with the Social Security Act. It's saying that we will set a line below which no one will fall, and when adversity strikes, you will not be left on your own. It's as basic as that. Now, you know, some people might say, well, isn't this just for rich countries? Well, of course, in the Depression, America wasn't rich. In the Depression, New Zealand wasn't rich. Sweden wasn't rich. Actually, most of the countries we today see as rich introduced these schemes when people were struggling. And so the message is basic social protection will help you consolidate development gains you've made. It'll keep progress going. It won't see you knocked completely flat. And what we saw in countries which had developed social protection schemes after the great financial crisis of the late 90s, we're in a much better position to deal with the financial crisis that began in the markets of the North and started biting in 2008, 9, 10. They came through much better because they had basic social protection. So that is critical. I mean, other factors, domestic resource mobilisation. It's very important that countries not just be reliant on whatever the fashion in the West is for funding this or that from time to time. You know, leadership and ownership means growing the cake of your own budget to allocate. And then we need these global partnerships. Development assistance is still important. It's a small part of the overall development equation, but it is important.
There's so many areas of development, from building roads, empowering women, but you've lately been focusing on health. Why health? Is that a bigger driver?
Well, you just can't separate health from development in any country. Yeah. And I come from a background of having been a Minister of Health and having set New Zealand health goals and targets to lift health status. I was very influenced as a young health minister by the World Health Organization's Health for All by the year 2000. Yes. I became health minister in 1989, and I thought, well, 2000 isn't far away. We'd better get cracking. But you see, Health for All put health in its context. How can people have good health if they live in poverty, without education and knowledge, in damp, inadequate, or otherwise shoddy housing, if their country's at war, not in a state of peace, if their environment is toxic? How can you be healthy? So it always put health in that broader context, developmental context. And that's why I think it's so important that the health people and the development people speak together and work together, because if we work in silos, we'll never get the job done. We have to recognise that health is so often an outcome of the circumstances in which we're living.
And so that's getting better.
Yeah, as people are lifted out of extreme poverty, as they have more knowledge, and knowledge empowers, as housing improves, if we can deal with some of the environmental blights which have associated the old style of development, like toxic air, filthy water, etc., then we will improve health for sure.
So why don't we take some questions from the audience? Do we have folks in the audience here? And then we'll take some online as well. Questions from here. Take one from online first.
We do have a lot of people participating online. So this is from Julia R. Carney. How do issues surrounding mental health in low-resource settings impact achievement of Millennium Development Goals? And does the UNDP have any plans to put investments towards this health area? Thank you for your time. These were mental health issues.
Mental health,
Well, we ourselves wouldn't be funded to work on mental health, but I think the question raises a very important issue, because mental health can be a very marginalised and neglected area in poor countries, fighting a lot of serious communicable diseases. And so as countries develop their comprehensive health strategies, it's very, very important to be ensuring that mental health is part of that equation. Like disability, physical disability, it has been a neglected area.
And also hard to measure. How do you know when you're doing well?
Exactly. I mean, when I was involved with promulgating health goals and targets in New Zealand, we didn't actually put mental health in because we didn't have a measurable indicator to know what progress we were making. But of course I did have mental health strategies and a lot of action going on in that, but I couldn't so easily quantify the progress.
Yeah. I have a question here.
What do you see as the greatest obstacle toward your goal for women in the world?
Well, it's the equal status and rights of women that is what has to be achieved, and the reality is that in many places women do not enjoy equal status, they don't enjoy equal rights, and that has a very broad impact. For example, if you look at agriculture in Africa, women are a very significant part of the workforce, but are less productive, not because they work less hard, they probably work harder, but because they lack often access to credit at the same level. May not be able to open a bank account without a husband's permission, and if a husband wants to keep women in her place, the last thing he's going to do is have her open a bank account. So if she can't access credit, she can't get the best seeds, she can't get the best fertilisers, she can't get the implements, she becomes less productive. And it comes back to a basic inequality in status. So what we emphasise with gender empowerment is tackling political participation and voice, because voice is very important for getting women's needs put up the top of the agenda. Women aren't in the system to express what these issues are. Chances are that others aren't going to be very forthcoming on them. We stress economic empowerment and equal rights and status, so that women really can operate on an equal basis with men.
Thank you.
You had a question?
Yeah, I think I very much appreciate the take on the importance of metrics, that we have to sort of be able to measure things in order to be able to monitor progress toward it. It seems to me that UNDP made a significant leap in gender empowerment by the development of the gender empowerment measure, for example, which influenced the generation of scholarship on this. Do you have a sense of a preview of what might come in after 2015? Are there movements to try to capture equality in other dimensions besides gender? There are all kinds of inequalities and social stratification in the world, and it seems to me that's been one missing dimension in the MDGs.
Yeah. So often when poverty is talked about, people are talking about income poverty, but poverty is multidimensional. In 2010, UNDP produced a sort of 20th anniversary Global Human Development Report, and it always produces a Human Development Index with the global report, but this one had 3 innovations in the index. Alongside the standard Human Development Report, it did an inequality adjusted Human Development Report, it did a gender inequality Human Development Index, and it did a multi-dimensional poverty index, which was worked on particularly with researchers from Oxford, I understand. And that gave broader insights into what the components of poverty are. So I think it is very important to recognise in the whatever global development agenda comes out of all the chatter now about post-2015, that poverty is recognised as having these many dimensions to be addressed, and that even if we got everybody living above the $1.25 a day figure, that's not going to mean that there isn't poverty. I mean, there'll still be hardship, and there'll still be a lot of other things going wrong if a lot of these issues of unequal status, access to education, basic health services, etc., aren't dealt with.
Question in the back.
Hi, I was curious your thoughts on moving from the fairly straightforward and one-dimensional model of the Millennium Development Goals to the more complex, convoluted, perhaps even conflicting sustainable development goals. And thinking, for example, of China, you mentioned their enormous reductions in income poverty. On the other hand, as we've seen in the news recently, the sort of staggering environmental burden in terms of air pollution and that sort of thing, and the fact that those two things are happening at the same time and largely for the same reasons.
Yeah, so I think we're really ready for the next big leap in what development progress means. The human development approach, which was developed by Amartya Sen and Mahbub ul Haq, was a huge advance because it said development is about more than just GDP per capita growing, which was the standard measure. So they brought in the broader dimensions, and the Human Development Index, which was put up as an alternative to GDP as a measure of progress, had GDP per capita plus a health indicator, was life expectancy, and plus an education indicator around literacy. But China obviously has done very well on all of those. But then look at the environment. I've been privileged to go to China many times in my life. I look out the hotel window many days of the week. I can't see anything, and people are breathing very bad air. Now, this is recognised in China, by the way, which has elevated its environmental agency to a full ministry and is very actively engaged in trying to, improve the quality of the environment now. But the next big leap then needs to be to see sustainable human development and bring in this environmental factor and weighting as well, because are we truly sustainably developing if we've moved on these other dimensions, but then we undercut it with the quality of the air, the toxins, the reduction in biodiversity, etc., etc. So sustainable development goals, MDGs. You see, partly my lecture today was talking about health and development people needing to speak together. Development and environment people desperately need to speak together. And at the moment at the UN, you almost have a two-track debate going, with a post-2015 debate, which is like what comes after the MDG target dates. There's the development people, and the environment people are focusing on the sustainable development goals, which they tend to be thinking of as environmental goals. We have to bring this together. I've given a lot of lectures and speeches on this over the course of the past year leading up to Rio +20 and then post Rio +20. We need integrated decision making. We need to aim for what I call triple win policies, where simultaneously you're advancing people's economic circumstances, their social conditions, and the quality of the environment in which they live. If you neglect any one of these, it's misery. So we have to have more integrated ways of addressing these issues.
Can you put together one measure that will be comprehensive?
Well, I have floated in my speeches the idea of having an environmental sustainability adjusted human development index, which sounds like a mouthful, but I mean, just as the human development index went beyond GDP per capita, now that we have to go beyond the human development index to bring in a weighting for environmental sustainability. And that could be done. You could pick, just as we pick what we're going to weight in health and education in an index, we could pick indicators for sustainability. It might be an indicator on water, it might be an indicator on forest cover, it might be an indicator on biodiversity, things that are measurable. But I do feel very passionately about this because we see our world careering towards planetary boundaries, most clearly demonstrated in the case of climate. And if we don't sort of rein this in, then a world living beyond its planetary boundaries is a world in crisis.
Other questions? From online, do we have more?
Yes, and we've talked about some of this, but can you talk a little bit more about some of the obstacles in the area of decreasing maternal mortality? I'm paraphrasing this question a little bit because we have addressed it a bit. Just a little more information about what has caused that.
Yeah. Well, to paint a broad canvas, for a start, if girls aren't able to complete their education and ideally go on their primary education, ideally go into secondary. In a number of countries, they will be destined for quite an early marriage. And an early marriage and childbearing that's too early really for the body to be able to cope well will make for bad maternal mortality figures. So that's the first thing. Come back to education of girls, empowerment of girls to make choices about their lives, the age of marriage, the age of the first baby. I think that's critically important. Secondly, a part of the Millennium Development Goal 5 on maternal health, which isn't talked about as much as the mortality rate, is access to universal reproductive health access. That's a kind of negotiated UN wording. It doesn't really say what it should, which is universal access to sexual and reproductive health services, which many women do not have. And many countries I go to, there is survey information on how many women don't have that access. And quite commonly, it's at least a third of women who would like to have access to information about how to control their sexual and reproductive health, but they can't get it. So that's another thing. Now, thirdly, for women in remote locations, the services often just aren't there. The access to a midwife, a skilled birth attendant, isn't there. Getting to where that service is may be near impossible because of the lack of transportation. So I'm talking about a whole lot of things here that aren't directly health sector related. I mean, that to actually get to the health service that would help you, you have to deal with inequalities, early marriage, lack of transport, gender empowerment, and so on. It's not a sort of one swing of the wheel to get better results here. It has to be seen as
becomes politics as well.
It's politics as well, the role of women, the place of women.
In this country as well.
Well, I did notice it was prominent in a certain election campaign.
So, another question from the audience?
Considering that nowadays there are a number of countries on epidemiological transition, meaning that they have managed to improve somehow the problem of the infectious diseases, and then others' problems are taking over. Are you considering adding other diseases to in your agenda that could be addressed through the United Nations?
Well, the exciting development in health at the UN is the attention now being given to the non-communicable diseases, which I think, again, had tended to be a bit dismissed as a problem of rich countries. Not so. Non-communicable diseases are extracting a very heavy toll of life and on disability in developing countries now, and unless arrested will be an extraordinary burden not only on human beings and their families but on the state budgets. For example, diabetes, reaching epidemic proportions, cardiovascular disease, the preventable cancers, the respiratory diseases. So these are now getting a lot of recognition. There was a high-level meeting at the General Assembly in 2011 which world leaders attended. Quite a wide range of ministers, and now concerted action around the NCDs and how to tackle the drivers of them. Tobacco, big tobacco has to be fought to make an impact on this. Alcohol, nutrition and diet, physical exercise, the importance of this. And again, this requires action that goes well beyond the health sector. It requires governments, ministers of finance, it requires the school as a platform for physical education. It's got many dimensions, but I think when we come to look at what will post-2015 look like with a health goal and agenda, these issues are going to have to come very much to the fore.
It sounds difficult for the UN to deal with some of these things. You have major corporations involved in pushing, for example, tobacco. And so how do you handle the political difficulties of dealing with tobacco and alcohol companies or food companies that are selling sugar?
Well, I think tobacco's become a pariah industry, and there's been a lot of action in the US, along with other countries, on regulation of tobacco. And I cut my teeth as a young health minister in 1990 with the New Zealand Smoke-Free Environments Act, which banned the advertising and sponsorship of tobacco, and legislated for smoke-free zones.
So some of the other countries now are feeling the pressure of the companies.
Well, that's right, and we were really fought by big tobacco, because they knew that if countries got, even a little country like New Zealand got traction on this, it would open the precedents for others. Before I introduced my legislation, I went to Canada, which had been one of the first. Canada and Norway were, but my legislation was better than theirs because we learned from what they'd left out. So, but what then happened was a lot of countries started then to do what we'd done, improve on it, and really ever since that 1990 legislation, we've seen tobacco regulation, the bans on advertising and sponsorship come ahead in leaps and bounds, particularly in developed countries. But that experience sharing needs to go worldwide, because tobacco, of course, when it had a dropping market in the West, it focuses elsewhere. So other countries are now the target of all the sophisticated techniques which are used to sell tobacco.
You have to have the cooperation of countries like China deciding to go to
Correct.
take their money, the revenue, or to and push off the companies.
Well, you actually do both. You take the revenue through high taxation, which diminishes the demand for the goods. So it's a sort of double win, really, isn't it? But the ideal is to collect no money from tobacco taxes, because nobody smokes.
Yeah.
So that's the ideal.
That would be nice. Question here.
I was wondering if the UNDP expressly and directly engages the private sector to achieve its objectives and agenda, or is it simply done through the policies or influencing policies of the constituent countries?
We have for some years now been interacting with the private sector through promoting what we call inclusive business models, which is trying to take companies beyond a traditional corporate social responsibility approach, which can lead to a few dribs and drabs of money for a clinic here or a school there or something that looks nice in the annual report, to an approach which says, in your business model, you've got to buy things, you've got to have staff. Now, you could, in your business model, design it so that you had a developmental impact in the communities you're operating in that goes beyond the sheer investment that you're making. In other words, how do smallholders, small businesses get into your value chains? What about the training and opportunities you're providing for local people? So it's a value chain approach that we've been adopting, and I mean, just at random, one of the approaches has been around sustainable platforms for commodities, so working with the big buyers and the small farmers in Ghana on cocoa, or in Costa Rica on pineapple, or now in Ethiopia on coffee, etc. So you take a commodity and say, well, how could this get higher value, which would help the smallholder and probably help the brand as well, and build in the sustainability aspect to that.
And another one from online. Oh, here we have a question here. Yeah, sorry.
I'm curious, how do you think that the shaky financial climate in a lot of countries may affect the achievement of these goals? Are they making kind of trade-off decisions that are really impacting, kind of where we're getting in 2015 and where we'll go from then on?
Yes, the financial crisis has certainly been a setback from a number of aspects. Firstly, where developing countries had migrant workers in countries very badly affected by the crisis, for example, African workers in Europe, well, the remittances didn't come home because, last on, first off is generally the story of the migrant worker, legal or illegal, so that hurt. Secondly, the demand of the advanced economies for goods from developing countries fell off. I mean, this is impacting on China's growth rate as we speak. and on the growth rate of others. I remember in late 2009 I had a meeting with the president of Mozambique on the margins of an international conference, and I said to him, how's the recession impacting on your country? Mozambique having one of the lowest GDP per capita figures in the world. He said, well, it's like this. He said, a lot of our people work in South Africa and they've lost their jobs, so the remittances aren't coming home. He said, our big export is aluminium, and the demand has dropped in half and the price has dropped in half. Ergo, unhappiness.
Yeah.
So it has hurt. And of course it has hurt development assistance. Last year, for the first time, overseas development assistance, for the first time in many years, it dropped down. And I mean, we see this reflected in our own budget, that we're getting quite late and unpredictable now cuts in our funding. But hey, that's small compared with what is happening to developing countries' assistance from the north.
Mm-hmm. Okay, we'll take one more from online.
This is a question from a viewer in Thailand. How has the UNDP been engaged, or how does UNDP plan to address and support universal health coverage as part of a sustainable and inclusive development effort?
Well, firstly, I'm totally for universal health cover.
Yeah.
You know, I come from a country which introduced universal health cover in the 1938 Social Security Act, and it's been a critical part of New Zealand's social fabric.
And we're getting there
ever
here.
since. And you're getting there. You're getting there. 1938 to 2009, was it? But anyway, some of us were a bit ahead. So what I would say, it is extremely important, but not in itself sufficient to guarantee good health. I mean, all of us want health care as and when we need it. But to guarantee improved health, we have to deal with a lot of other things. And I've been painting a broad canvas on that today. You know, people's state of education, their state of housing, the knowledge they have around what is actually causing ill health, the broader environment of a clean environment, absence of war, etc. And so I think that when we look at the 2015 agenda, we need to have a goal which is expressed around health and well-being, which could be healthy life expectancy, who knows. And then you would have a number of targets. And personally, I would support universal health cover being one of them. There was a General Assembly resolution to that effect passed late last year. But I think we also need other health goals and targets, which will be measurable. Specific ones, yep, where we measure the rate of progress as we have with child mortality and maternal mortality, but also ideally tackle some of the drivers of bad health, like tobacco. You know, there's plenty of sets of goals and targets out there that we could learn from and deriving some good ones for the global agenda.
That's a phrase that has come up a lot more lately, social determinants.
Yeah.
Terrible phrase. As a journalist, I can say that's a rough one. But tell me why that is coming up now. What is that issue about?
Well, I think as the world really gets a grip on a lot of the major contagious diseases which cause so much misery and ill health, and moves to tackle a rather more complex health agenda with the NCDs, non-communicable diseases in particular, a lot of this takes you back into a broader focus than perhaps in the past. And I think it is a welcome recognition that attaining a better standard or status of health for all is not going to come just through a medical service. It's going to come from the conditions in which we live. Do we live in poverty? Do we live ignorant? Do we live in housing which is hopeless? Do we have clean water and sanitation? We have to address these broader issues.
Sounds like we're thinking very differently now than we did in the 90s, say, and up to 2000 when the goals were set. That it looks more complex. You have to do more measurement, more numbers, thinking outside the box more than before.
I think the experience of 12 years of the goals suggests we have to look a lot more at what the drivers of the problem are. It's not just a matter of saying, yes, let's reduce maternal health, let's reduce child health, let's reduce poverty. Well, what is actually going to do that? Because just talking about it won't do it. You have to actually have practical policies implemented which will make a difference to those drivers.
So we've been through this one round almost. We're almost finished with 2015. What do we do now? What does UNDP do to make the next round? Is it another 15-year target, or what will we do?
Well, there's a global discussion going on this as we speak, and it's got a number of aspects. Yes, we are, with other agencies in the UN system, leading, facilitating, supporting consultations on what comes next. And those consultations will be held in at least 60 and probably close to 100 developing countries, because we think it's extremely important that developing countries should have a say and input into what the next agenda is. There's also what we're calling consultations around themes: health, inequality, energy. They're being conducted in various capitals. And there's a global virtual dialogue on the internet, because these days you need to crowdsource ideas and feedback, so that's all happening. And that will be brought together with, you know, sort of the best analysis as to, well, what is really coming through about the future we want, which was the phrase of Rio Plus 20, the future we want. What is that future, and what should we focus on to move towards it? Alongside this exercise, the Secretary-General has a high-level panel on the post-2015 agenda. It's co-chaired by the President of Indonesia, the President of Liberia, and the Prime Minister of the United Kingdom, and has representation from across the world. That will report in late May, June. And then the UN General Assembly has appointed a group to also look at what has come out of Rio Plus 20, and in particular Sustainable Development Goals. Now, that's why I say development and environment tracks need to come together, because at the moment, although Rio produced a very wide outcome document, I mean, it touched on everything that could impact on sustainable development: social, economic, environmental. Still, when people talk about sustainable development goals, they tend to be talking environmental. Now, we have to bring the tracks together so that we are talking about how we advance human development and well-being within planetary boundaries. How do we bring these two things together?
Sounds complicated.
Well, it is complicated.
You bring this strand and this strand and this strand, and including the strand with internet, listening to all kinds of voices. Is that really happening? How do you bring that in?
It is, and we get tremendous engagement through social media. So, in fact, this is not the first time it's been used to explicitly source ideas from the global public. UNAIDS in the last couple of years has used social media to crowdsource ideas and approaches for its HIV and youth strategy. So you need to hear from the voices of the people intimately concerned.
So should we expect in 2015 that these strands will come together and we'll get one meeting in which we settle on new goals?
That's the aim in 2015. Now, the question is how to get there, because there'll be tremendous amount written and spoken about this. It can be analysed. I think the question in the end is whether it's thrown back to the UN system to say, okay, having heard everything, what do you propose? Because to get a clear set of measurable goals and targets, it's hard to do that by committee negotiation. So just how that final step's taken is a little bit up in the air at the moment. But from UNDP perspective and my own perspective, it would be good to have another set of measurable goals and targets which are easy to communicate, because otherwise development becomes everything again. And if you focus on everything, you miss everything. You have to say, these are the things we're going to prioritise. Not saying that other things are not important and people shouldn't pursue them, but as a global community, we need to mobilise action around these priorities, because this will make the greatest shift in
Right.
human well-being.
So again, maybe a limited number, ones that you know you can measure,
Yeah.
and go after those.
Yeah.
The first time around, the goals were quite ambitious. Again, would that be a good idea? Very ambitious, knowing some countries are going to be not on the map practically?
See, global goals are too ambitious for some, and others have already reached them. That's so on the law of averages.
Yes.
That's the way it's going to be. But if you've already met them, then you should actually develop your own MDG plus targets. And some countries did that. Some, by the way, also did MDG minus because they said we can never get there. So they set their own.
Yeah.
Yeah.
Tell us something about the winners, some of the ones that came along really well in this last round that looked like they weren't going to make it, and then. Phew.
Well, let's give a couple of examples. I'll give African examples. Rwanda and Ghana. Rwanda, well, I'm not sure if everyone in this room is old enough to remember the genocide of the mid-90s, but it was shocking, terrible, horrific. So here you have a shattered country, somewhere between 800,000 and 1 million people killed in cold blood in a relatively short period of time. How do you pick yourself up and start again? Well, the truth is Rwanda has. And in socio-economic development terms, undoubtedly, it's been a success. It's had strong leadership, very focused. The women have been right in there in the decision making and in big numbers. They've made huge progress. Ghana, of course, in my lifetime, was I think the first African country in the British Empire to achieve its independence, but had a number of rocky years with military rule, but made a transition. Now Ghana has done quite well on the MDGs, and specifically on poverty, where it targeted its agriculture. Agriculture is still where most people in many developing countries, particularly Africa, are living and working. So if you neglect agriculture, you don't enable people there to lift their living standards. And it also contributes to poor nutrition, food insecurity in the country. So Ghana focused on agriculture, and it has done extremely well.
Good leadership and also issues of corruption in other countries where it doesn't work out so well.
Yeah, and Ghana's actually done quite well on that measure as well.
Yes.
And to say another very positive thing about Ghana, it is a late entrant to the extractive industry boom. And so it's had time to look at the mistakes made around it. Nigeria has suffered from the resource curse, violence, despair, conflict, corruption. Ghana has taken a lot of advice and has legislation which enables revenues to be corralled off, and very importantly actually legislates for a civil society monitor group to monitor on what's happening to the revenues. Now, I'm not going to say it's going to be perfect, but the approach to dealing with this is a sound approach.
Something we can do about the countries those are success stories, some of them. What about the ones that are farthest back? Is there anything additional we can do?
Right. So the ones that are furthest back, almost without exception, countries which are mired in deep internal conflict.
Yeah.
Afghanistan, Somalia, Democratic Republic of Congo, still very troubled in its east. Think of Mali now, what MDG can it achieve in the current circumstances? So, conflict is a blight on development. You just can't make progress if people have no security. And this issue of, human security, am I safe in my environment, is blighting development in, of course, parts of Central America, Caribbean, the continent of South America, and places that if you fear for your physical security because your neighbourhood, your community is run by gangsters and crooks, and you fear for your life, you don't invest in that community. So that de-develops as well. This citizen security is a very, very big development issue in regions in Central and South America.
Okay. So let's take a last round of questions from the audience here or online. We have...
You were saying the Millennium Goal for poverty is met, and mostly it's from China, like you were saying. But is it, how do you measure it when you have one figure for countries like China, and then you were saying Mali, and how do you go about it even going forward, even though it was met, like the 50% is met, but for other countries it's almost maybe nothing, or maybe they're going backward.
Yeah, so it's set as a global goal so that the numbers of people living in extreme poverty under the $1.25 a day line was to be halved by 2015. And in fact, the numbers from 1990 were halved by 2010, largely because some 600 million people in China were lifted out of poverty. But of course the goal was never a complete goal, was it? I mean, the goal is to eradicate extreme poverty. The target was to cut it in half. Now that's great if you're in the half where it's been cut, but not if you're in the other half. So that's why the sort of rolling on development agenda has to keep focusing on extreme poverty, because still there's that very, very large number of the world's peoples, 1 billion, round terms, shall we say, who live in extreme poverty, and roughly the same number, and generally roughly the same people, living with chronic hunger as well. So the job is not done.
Question here.
To follow up on the poverty, how can you eradicate poverty in societies and countries that operate on a caste system, where something as fundamental as your family name determines the opportunities you have in life?
Very difficult. So again, it speaks to a broader agenda around rights and empowerment and equality of citizenry, so that people simply can't just be marginalised and excluded because of the caste, the class, the gender, the differentiating factor into which they were born. It is a broader equality agenda that is needed to deal with that.
Again, political.
Again, very political. Yeah. Very political.
Question over here.
Thank you. You mentioned the development consists of many aspects: the security, economic, social, environment. And I wonder, how does UNDP set a priority list in dealing with all those? What is the best way of allocating our global resource or social resource? Thank you.
Well, we have to prioritise like everyone else, and we're painting a broad canvas today. I mean, one of our jobs also, of course, is as the leading agency in the UN development system, we are the sort of lead advocates and coordinators. So we do advocate across the broad range of issues, but then our own working mandate is set by our board, and our mandate tells us to work in the following areas: crisis prevention and recovery. So that is referring to states in distress because there's war, conflict, breakdown in social cohesion, trying to recover from a bad disaster, Haiti being a case in point.
How do you intervene in those crises? With dollars, with aid, what?
So if you take Haiti, which had the earthquake barely 2 years after a devastating cyclone, people were in a pretty fragile position before the earthquake, and so it got much worse after the earthquake. So what did we do? I think probably the most practical thing we did was encourage the donors to support us with short-term job schemes. And the short-term job schemes were geared to debris removal and getting basic services going again. The fact that people were paid for their work meant they could then go and buy something from the little trader down the road. It started the local economy going again. It had positive aspects, and there were, I think, I wouldn't be exaggerating to say, around 250,000 short-term jobs created, which might be a few days here or there, but enough to get people kind of started again. But the debris work has gone on a long time. So early recovery is actually our specialty, our niche in these situations. The humanitarians come in, they do food, water, shelter, as you see with Syria or after an earthquake. But we come in with the early recovery tool set. How do you get people back to work? How do you get them up on their feet again and moving? And then that leads us into a very important mandate, which is disaster prevention, risk reduction. In Haiti not only has this terrible earthquake fault which goes along the south, it has one that goes along the north, which wiped out most of a city in the 19th century and is poised, to go again. So we are working very intensely in Haiti on earthquake risk reduction. It's a hard call. So similarly with adaptation to bad climate events, etc. That's all. Poverty reduction generally is obviously a big mandate area for us, working alongside governments, good strategies, policies. We work on environment and energy, and increasingly we have to see these as very integrated challenges. We can't deal with them in silos. We have governance, broadly speaking, as a huge area. I mean, what underlies a lack of traction on development is often just poor governance, bad governance. Systems don't work, institutions don't work, there's no accountability, there's not enough integrity and honesty, so that's all our bread and butter work. Right across that we work on gender, which is extremely important. And then we have actually become rather involved in health from the starting point of HIV, malaria and TB. And you might say, why? Well, with the MDG on HIV, malaria, TB, that was, I guess, one of the forces behind the formation of the Global Fund, which raised zillions of dollars for HIV, TB and malaria. But the Global Fund is a fund and it has to disperse money. And there have been, on average, around 30 countries where it cannot find a national partner it can disperse the money through. That is because it doesn't have confidence in the government systems or in NGO systems, or in some countries there won't even be NGOs. So then it formed a partnership with UNDP and said, UNDP, you're there, you're operating because you're everywhere, would you do this for us? And that's taken us right into how do we build capacity for countries to deal with these issues in the future. But it's also given us a platform for understanding how you can leverage from that more broadly for primary health care and for health system improvement.
So maybe one final question.
Okay, I do just want folks to know there are a lot of questions online, and you can go on to our site and see some of those, but they're coming in all different order. But this is one from Twitter that came in. Progress against infectious diseases such as malaria has been a significant success story of the MDGs. Action will need to be sustained to prevent backsliding in malaria resurgence. How can we prevent the broadening of the post-2015 health agenda, inadvertently undoing the successes we have seen through the MDGs?
Well, we certainly can't take the focus off malaria because malaria has been such a huge killer, particularly of children. And I suspect if you look at the interrelationships between the MDGs, with the child and infant death rates coming down so sharply, the decline in malaria deaths will have been contributing to that a lot. And the whole rollout of the bed nets and so on. But bed nets don't last forever, do they? You have to replace bed nets. So this has to be really built into and systematized and prioritized in countries' health strategies. But it is critical that the global health agenda now does also make space for the NCDs, because the cost to poor countries of NCDs not addressed is going to be just too big a burden, to put it mildly. You know, you're looking at in China, I understand figures are used of around 100 million people with a diabetic condition at some level. This is not a small number of people. So, you know, obviously a lot of diabetes can be dealt with through appropriate diet and the way we live and so on, but where it comes to more intensive treatment and care on this scale, this is extremely expensive.
Okay, well, that's it. We had really excellent questions from the audience, and the conversation will continue online at www.forumhsph.org. Thank you very much.